Our Makerspace project revolves around the topic of asthma education. The problem with asthma education is that it is lacking for parents and their families. My cousin, who educated my group and I on this topic, tends to work with the pediatric population, so this is mainly geared towards this age group. A lot of patients she took care of in the PICU were asthmatics that were non-compliant with their daily inhalers and needed medication. This caused them to become what they call frequent flyers to the emergency department and the ICU. These patients would come in with severe respiratory distress and require several days of hospitalization to stabilize their breathing. This ends up leaving families with significant hospital bills. This is why my group and I proposed the solution of an asthma education class for children and their caregivers, explaining exactly what asthma is, how to properly use an inhaler with a spacer, how to effectively obtain medication, and how to identify signs and symptoms that the medication is not providing relief. An asthma diary would also provide a great way for doctors and nurses to trend how frequently patients are experiencing symptoms and using their rescue inhaler.
There are many pros and even cons to our solution of an asthma education program. It was found that these programs increased symptom-free nights for patients, and their caregivers were more likely to have their child's asthma under control. It also resulted in families being 68% less likely to have hospital visits, which in turn improves efficiency of available nurse and patient time. With childhood asthma being one of the most common causes of school absences for children and missed work days for parents, this decrease in hospital visits would improve the quality of life for not only the child but also the parent. There are also cons, as always, to any solution that anyone has. For ours, it would be definitely time and money, as parents are going to have a hard time being able to work around their already busy schedule to sit down in a class for multiple hours, and obviously money. It could cost a lot of money when they're already spending X amount of money to have their child cared for due to the asthma and complications that come with it. And it was also found that in a study, a child's age can affect their knowledge about factors causing asthma and the ability to properly use an inhaler. And it was found that it actually negatively affected their self-efficacy.
So because not everyone may have access to an in-class program, a good alternative for the solution would be to offer it online, and doing so would likely increase the number of patients and families that are receiving this education because they don't have to come in for the class, they can just do it online, so there's likely going to be more participants. And also it would be more cost effective. Just one reason would be you don't have to spend the gas money to show up to the class, so that's how it would cut down costs. Also, you probably wouldn't have to pay like the leader of this class. If someone's teaching the class, then you're gonna have to pay them, but if it's just an online program, the company probably wouldn't have to pay them as much, at least. And it also would allow families and these patients to work around their own schedule. So if it's online, you can access it anytime throughout the day, and you don't have to set out a specific time during the day to block off and to go show up to class. You can just do it anytime. So that would also be helpful because they can just work around their own schedule.
So, what is this diary log that we keep talking about? The diary log will help a patient keep track of all of their medication intakes, their inhaler use, any symptoms that they might be having, or asthma episodes they go on during a week, and so that they can log their anything that they need on a weekly basis in their diary log. And it just kind of helps them keep track of everything. They can write notes on things to update. But since we know that a lot of the patients that have these asthma conditions are so young, they can often forget to do these things or not even know how, which is why it's so important for both parents and nurses to be right there to help. Patients and nurses will work closely together to regularly update the diary log, and that way nurses can closely monitor these logs, creating more of a personal relationship between the patients and the nurses, which can reduce the hospital visits and hopefully overall tasks. So say you're an asthma patient, you use your inhaler. First thing you do is you go and you write it in your trusty diary log. Oh, I had a bad episode today. Or this is when I used my inhaler, or I did this and it caused an episode. That way they can kind of monitor and keep track of what's causing it.
So overall, these educational programs for patients and parents will encourage change and emphasize the use of these diary logs. And the education program that we have chosen to teach the patients and parents outline a lot of key information that is helpful for their well-being, including exactly what asthma is, how to properly use an inhaler, and how to identify any signs that the medication you're taking is not providing relief. And additionally, the diaries that come along with the education program will be helpful because they log the patient's medication intake, which this is helpful because if you do have to make a hospital visit or a doctor's visit, then your doctors and nurses will be able to see right in one place how you've tracked how often you are having any symptoms and needing to use your rescue inhaler. So with all that information in one place, it's really helpful for their doctors and nurses because they can access it quickly and know exactly what you are experiencing at home. So overall, the patient's well-being will improve and they'll be able to manage their illness with treatment from home, which is helpful because the families will not have as big of financial burdens that come along with frequent hospital visits because you are able to take care of yourself from home.